Welcome to Monday's edition of COVID-19. While there has been a decline in daily infections here in Korea, authorities are linking the fall to a drop in the number of screenings this past Sunday and not to a shift in trend. Now, speaking of trend, we explore the troubling rise in vaccine nationalism later on in the program. Here first is our Kwon Soa with the pandemic updates. Now, Soa, just start us off then.
Yes, Sunny, we're starting off the new work week with almost 100 fewer COVID-19 cases than on Sunday, as 384 infections were reported this Monday as of 12 a.m. And that's 370 domestic infections and 14 cases from abroad. In total, Korea's accumulated figure stands at 102,141 with 1,726 fatalities. Now, Monday's caseload marks the first time in 6 days that we have dropped to the 300s, but on Saturday we had even a number above 500, which was the highest in over a month. So we will still have to monitor the rest of the week when it comes to the daily tallies. Now, this Monday, Gyeonggi-do province reported 131 cases, followed by 107 in the capital, Seoul, and Incheon with 18 infections has now hit 5,000 cases in total. And with resurgences down in Busan, this city is mulling over an upgrading of social distancing measures. Speaking of social distancing, as the daily infections are steadily in the 300 to 400 range, beginning this Monday, social distancing measures at level 2 in the metropolitan region and level 1.5 in the rest of the country will remain for an extended 2 weeks, plus a few new rules, that is, have been implemented regardless of social distancing measures. Eating will be banned at 21 public establishments, including sports stadiums, libraries, and museums, as well as entertainment venues like singing rooms and movie theaters, public saunas and bathhouses, and also education facilities like cram schools and study cafes. Meanwhile, at nightlife entertainment venues such as pubs, bars, and clubs, QR code entry locks will be mandatory, and that goes for every individual of a group of visitors.
I see. Meanwhile, so on the local vaccine front, I believe authorities are a step closer to granting the green light for a third COVID-19 vaccine.
Right, Sunny, and we are talking about Johnson & Johnson's Janssen vaccine that's expected to be provided to Koreans beginning in the third quarter of this year. So the Drug Ministry this Monday announced the results of a meeting of a panel of experts who assessed Janssen's efficacy rate at close to 67% 2 weeks after the inoculation. Now, this review was the first out of 3 evaluations before the government can make a final authorization. And now in other vaccine news, beginning next month, people who receive their COVID-19 shots can get up to 2 days off, as authorities have been saying that around a third of vaccine recipients reported feeling post-inoculation discomfort. Now, so far, we've got almost 794,000 people who have been inoculated. And as the new work week has kicked off, we will see this number of daily vaccinations increase again. And meanwhile, if we take a look at the international front, we've got almost 31 million cases in the U.S., followed by 12.5 million in Brazil. Here, the Brazilian variant has been now detected in around 20 countries around the world. Sunny is going to make a Skype connection to Brazil in a bit. Meanwhile, France has surpassed Russia in total cases. Let's take a closer look at the daily increases. Let's start with France here. Some 37,000 new infections in a day, and quite a surge in India with over 68,000, which has now hit 12 million. Also, many new infections down in Poland with almost 30,000 new COVID-19 cases. And the total number around the globe now stands at 127.7 million. Those are the updates I have for now. I'll see you back in a bit after the government briefing. Sunny?
All right, so thank you for that. Right, staying on the international arena, Brazil has been recording the highest number of COVID-19 fatalities per day amid the presence of a variant that is raging among the younger adults. For more on the situation there, I have Luana Ferreira live on the line. Welcome, Luana.
Thank you for inviting me again, Sunny.
Right, Luana, healthcare workers there believe that Brazil will be losing 4,000 lives a day in the near future, having already recorded more than 3,000 daily fatalities in recent days. How severe is the situation in Brazil, Luana?
Well, right now we are experiencing the most dramatic moment of the pandemic in the country. Right now we have an average of 2.5 thousand deaths a day, and Brazilians today are witness now of the collapse of the health system in the country. They have a huge waiting line for the intensive care. We don't have enough medical staff because they are overwhelmed with work and they're exhausted. It's also difficult to treat other diseases because there is no room in the hospital. And even for patients who need to be intubated, they don't have enough medication.
I see. Luana, almost a third of those who lost their lives were reportedly younger than 60 years old. How are health experts there explaining this tragic reality?
Well, we all know that when the pandemic started, we were more worried about elderly people and people with other health problems. However, with the spread of the virus, it's out of control and we had new variants. And the Brazilian variant that started in Amazon and spread all over the country, it's more contagious and it also spreads faster. And it reached the new group because now the younger people between the 30s and the 50s, they also get infected and with more severe symptoms. And in the last month, we have over an increase of 500,000% of the case in this group, and they also need twice more time in the hospital.
I see. Luana, I hear public discontent is escalating over the government's handling of the pandemic. Could you tell us a bit more about this?
Yes, it's not something new that people are protesting against the president. As we know, he's not taking serious measures against COVID. But there are over 70 requests for his impeachment at the moment. However, there is not enough numbers. It's not strong enough among the congressmen to have the impeachment move on, to go forward with it. And besides that, he's also not managed well the health crisis, as we know. And we have 4 health ministers since the pandemic started. And the 2 first ministers, they quit because they said that Bolsonaro didn't believe in science and did not want to follow their advice.
I see. Meanwhile, Luana, what is the latest on the vaccination front in Brazil?
Well, at the moment, we have nearly 15 million people vaccinated. Although the number sounds big, it represents only 7% of the population in Brazil. It means that we are far away from the target of 70% of people inoculated to be safe. And we have the capacity. The sad part is that we have the capacity to vaccinate 3 million people per day, but we are never vaccinating more than 500,000 in a good day. The average is between 22,000 to 500,000.
And why is that so, Luana?
Well, first, right now we are dealing with just 2 vaccines, the AstroZeneca and the CoronaVac. And we were too slow to negotiate vaccines. The Pfizer sent us 1,000 of deals, and we were too slow and the offer to Pfizer. And we should start to receive more vaccines in the second semester. And according to the government, we should vaccinate the priority groups. That means the older people and people with comorbidities and people who work in the front line until September. And just after that, we are going to start to vaccinate the other groups. That means that in this speed, we are just going to vaccinate 70% of the population in the end of the next year.
I see. Luana, what has been the public response to COVID-19 vaccination in Brazil?
Well, people are actually very enthusiastic about the vaccination because it's a relief. You see, glimpse of hope in the middle of so many deaths and so many negative numbers. There is still, of course, people who are afraid of taking the vaccine because there was a huge spread of fake news about the side effects of the vaccine, and that's also another problem. But people are very positive, and everybody's looking forward to be.
Right. All right, Luana, as always, do take care, and thank you very much for making the time to join us live at this very early hour at your end.
Thank you very much.
Right. To our viewers, we do also apologize for the slight disruption in audio with our connection with Luana. Now, among the questions regarding COVID-19 vaccinations is that related to blood donations. So can you donate blood after being inoculated against the coronavirus? We tell you in this report.
Public workers at this state-run facility have lined up for a blood donation relay in cooperation with the Korean Red Cross. Campaigns like these are playing a crucial role in alleviating the country's shortage of life-saving blood, especially amid a pandemic.
코로나 발생 이전에는 보통 평균 보유량은 4일분, 혈액 보유량은 4일분 이상으로 유지되었었습니다. 하지만 코로나19 발생 이후 헌혈자들이 많이 감소되어서 현재 보통 3일분 전후로 지금 유지되고 있습니다. 혈액 보유량을 안정화하기 위해서라면 하루 평균 8,000명 이상 일주일 이상 지속이 되어야 합니다.
The number of blood donors has plummeted across the world amid fears stoked by the COVID-19 pandemic. Korea is also reporting far fewer blood donations due to the effects of the country's social distancing restrictions.
매출도 좀 조심스럽게 되고 하다 보니까 그런 것 자체가 좀 망설여질 것 같아요.
혈액과 코로나에 대해서 약간 좀 그런 부담감이 좀 생겨서 그런 이유가 있는 것 같습니다.
소독하겠습니다.
But medically speaking, there is no risk of contracting COVID-19 from the blood donation process.
어지럽거나 힘든 느낌 있으면 바로 말씀해 주시고요. 코로나19는 호흡기 감염 질환이기 때문에 여태까지 혈액 이완된 사례는 한 건도 발견되지 않았습니다. 걱정하지 않으셔도 됩니다.
Medical workers are taking all necessary precautions to prevent an outbreak at blood centers and provide a safe environment for those willing to donate life-saving blood.
저희가 시간대별로 철저하게 소독과 환기를 진행하고 있고요. 주기적으로 방역 업체를 통해서 소독을 진행하고 있기도 합니다. 또한 내부에서 사용하는 모든 물품이 일회용이기도 하고요. 헌혈의집과 헌혈버스를 찾아주시는 모든 분들은 체온 측정과 손소독 그리고 마스크 착용을 의무적으로 하고 계십니다.
There is another important question on the mind of would-be blood donors. Can they still donate blood after getting a vaccine?
헌혈하셔도 사실 별 문제가 없다고 생각을 하고요. 그런 백신 접종 후에 금지 기간이 설정됐다는 그런 이유만으로 뭔가 불안감을 가지고 접종 후 헌혈을 좀 자제하거나 이런 주저하거나 이런 일이 생기지 않도록 그 헌혈하시는 분들에게 좀 설명하는 것들도 좀 필요할 것이라고 생각을 합니다.
This local doctor gave his blood 2 weeks after being inoculated and says he hardly noticed any differences.
헌혈 전에 무엇보다 컨디션 관리가 중요하다고 생각해서 접종 후 2주간 충분히 시간을 가진 뒤 헌혈을 진행하였습니다. 백신 접종을 했다고 다른 이상 증상이 있는 것 같지는 않았습니다. 충분히 시간을 가지고 나면은 몸 상태가 원래처럼 돌아오기 때문에 걱정하지 않으시고 헌혈 진행해 주셨으면 좋겠습니다.
Experts also say there is little to no risk of any side effects from donating blood post-inoculation.
요즘 헌혈의 집에서 헌혈 전에 문진을 강화하여 반드시 이번에 같은 경우는 백신 접종을 언제 했는지를 물어볼 가능성이 있어서 코로나19 바이러스 백신 접종에 대한 정보를 혈액원에 공유하면 될 걸로 생각합니다.
A little courage on the part of ordinary citizens will go a long way to help Korea overcome its blood shortage and to help save lives.
나의 20분 시간의 투자로 누군가의 한 생명을 구할 수 있습니다. 생명을 살리는 일에 많이 동참해 주셨으면 좋겠습니다.
좀만 용기 내주셔서 근처 헌혈버스, 헌혈의 집에 방문해 주시길 부탁드리겠습니다.
Up next, we are poised to join the regular briefing on the COVID-19 situation here on the local front for this Monday. Now, I understand the briefing is about to start. We'll come back to you afterwards.
무대 위로 오셔서 설명드리도록 하겠습니다.
First of all, we have Commissioner Chung Eun-kyung, and will be followed by the department head of the vaccination investigation team. And first of all, here is Commissioner Chung Eun-kyung. Let us now begin our regular briefing on the COVID-19 situation and the inoculation status here in South Korea for March 29th, Monday. As of today midnight, we have 370 new local infections and 14 new imported cases. The total caseload now stands at 102,141. And currently, 6,291 people remain in quarantine, and there are 100 patients with critical or severe conditions. And we had 4 additional fatalities, with the accumulated death toll standing at 1,726. I extend my deepest condolences to the deceased and the members of the bereaved families. And here are some updates on our weekly assessment indicators. And during the past week, on a daily average, we had 422.1 cases, which is about 1.5% increase from the previous week. And we had 17 daily imported cases, which is on a constant decline. And here domestically, we are seeing a 400 range of our daily tally, and the number is being stagnant. And last week in Gyeongnam and Gyeongbuk provinces, we have seen many public facilities, including saunas and workplaces, being subject to the cluster infections, which has also contributed to the rise in the daily tallies. And looking at the sources of infection for the past week, we have seen a steady increase and reaching about 40%. As for those who have been come into contact with the previous cases, and we have a 27.1%, which are still under investigation, meaning that this number is increasing on a weekly basis. And as for the new cluster infections, we had 13 additional ones, and we also had workplaces like the logistics centers, and also we had restaurants and pubs, and also churches and saunas, as well as other indoor sports facilities being the subject of cluster infections. We are seeing a continued decline in the number of critically ill patients and the death toll as well, and the fatality rate has dropped to about 1.7%. And last week we had about 25 fatalities, and half of them were above the age of 70. And as for the sources of infection among these fatalities, we have seen 9 of them were exposed to the virus at nursing hospitals or hospitals, followed by those who have been exposed to the virus at workplaces. And we are also seeing a decline in the proportion of patients of migrant workers. And also we have seen about 9.2% of the people among the total cases last week being these migrant workers. And we are also seeing an on-year lower than our annual average as for the influenza outbreak. And last week, we have seen that we have been looking at the new variant cases for about 632 cases last week. And out of the 580 cases, we have seen that 22 cases have been identified as the new variants. And also 18 cases of imported new variants as well. And we are seeing a high rate of these new variants standing at about 44%. And a total of 287 new variants have been identified so far here in South Korea, with the UK variant accounting for 349, and also followed by the South African and Brazilian variants as well. And as for the newly identified new cases of these new variants, 18 were imported and 22 22 were all domestic cases, being all Korean nationals. And out of the 22, we have seen that 3 of them were related to cluster infection, one related to the Ulsan city's assembly for car manufacturing, and also we have seen that they were the UK variants. And currently here in South Korea, we are seeing the 400 daily tally for the 3 straight weeks. And we believe that in April, we could have further risks of infection, including the seasonal factor as well as the religious events that are slated to be scheduled. And we are also having ease social distancing measures, meaning that we are also having more risks of a cluster infections stemming from public facilities, including nursing homes and saunas, as well as restaurants and places of worship. And to this end, we are also intensifying our basic rules, and we are also going to provide more detailed and tailored guidelines for public bath places as well. And we are also going to intensify our massive testing for those who have symptoms. And going forward, we will be also sticking to our conventional quarantine measures. And we also have many risk factors stemming from the Easter Day, as well as Ramadan and other religious events that are scheduled during April, as well as the spring weather. And we are seeing these risks, and also to this end, we will be cooperating with the religious circles to intensify quarantine measures. And second, we also have many people who will be enjoying outings to enjoy the beautiful spring weather. And as announced before, we will be having a special quarantine measures for these spring festivals. And we also have the risks of the new variants spreading here in Korea as well. And to this end, the quarantine authorities will be intensifying our monitoring for those who are on self-quarantine after coming into Korea from other countries. And as for those on self-quarantine, we will be carrying out regular testings and monitor their situations and conditions. We would like to also note that starting from today, during the next 2 weeks, we will be subject to the new extended social distancing measures, and at public facilities, we will be having the intensified basic rules of quarantine. So we ask for your continued support. And regardless of any locations, we ask you to wear your face mask whenever you are indoors, and also minimize a time when you have to take off your masks, including smoking or consumption of food, and also conversing with each other. And if you have any clinical symptoms like fever or respiratory symptoms, we ask you to get tested as soon as possible. And lately, we have seen some risk factors at restaurants and cafes. And the COVID-19 symptoms, if you have any symptoms, please do not go to these facilities. And if you also go to these multi-use facilities, please enter your entry log, and also monitor your conditions and wear your face mask. And also, please refrain from having dialogue while you consume food, and minimize the time of stay at these places, and also carry out 2 meters of social distancing. And next, we also have some updates on our status of COVID-19 vaccinations. As of today midnight, a total of 793,966 people have been administered with the first dose of COVID-19 vaccines, and the second dose recipient stands at 5,232, and we have about 84% of the target of the first priority group, and about 93% of the target among those who have given us consent. And also, we have seen about 19% of the vaccination for the eligible recipients for the second quarter. And currently, we have 10,347 cases of the post-inoculation adverse responses being reported, and most of them, 10,215 of them, are mild and common symptoms, including muscle pain. And also, we had 101 suspected cases of anaphylaxis, 10 suspected cases of severe cases, including convulsion, and 21 cases of death have been reported. During the past week, we have been looking at these post-inoculation adverse responses, and here are some details. We have also seen that the adverse responses have been reported among 1.3% of the recipients, and the severe cases and death have been reported. We have seen about 26 cases of these severe cases and deaths, and most of these symptoms were muscle pain, headaches, and fever. And as for the suspected cases of anaphylaxis, we have seen 95 cases being reported, and 5 of them were anaphylaxis shocks, and about 90 were responses similar to the anaphylaxis reactions. And we have seen that 50% of the post-adverse responses have been reported on the day, and about 90% of these have been reported on from the first and 3 days after the inoculation. And we have seen more women reporting these adverse responses, and we have seen the younger group being subject to more increased adverse responses. And as for the types of vaccination, we have 1.9% being reported among the AstraZeneca vaccines and 0.41% of the Pfizer vaccines. And next, we also have a timeline for our procurement of the vaccines. By individual contract, we have also seen that 500,000 doses of the vaccines have been arrived here in South Korea, and an additional 500,000 will also arrive soon here in South Korea via Incheon International Airport. And also in April and May, we will also have a weekly arrivals as well, and also in June, we will have the rest of the vaccinations being arrived here in South Korea. And as for the AstraZeneca's vaccine, we have about 7 million doses to be arriving in South Korea from May to July, and we are also discussing the details. And we have seen one change. Through the COVAX facility, we were supposed to have the AstraZeneca vaccines, and this has been delayed compared to our schedule. And we have seen that 430,000 doses will be arriving a little bit later than scheduled, and we believe that this reflects the delivery delays in a global level, and we believe that this has been adjusted by the COVAX facility. And Janssen and Novavax, and we will be also continuing our negotiations, and as for our negotiations are completed, we will be providing the details to you as soon as possible. And further, we also have plans to inoculate senior-aged citizens over the age of 75. And starting from April 1st, we will be kicking off inoculation for this age group. And we believe that until July, we believe that we will be providing them with the Pfizer vaccines, and also we will having the vaccinations and these doses of the vaccine being shipped out starting from tomorrow. And starting from also, we have been also receiving our, we will be rolling out our inoculation and vaccines in our elderly welfare facilities and nursing homes as well. And by local governments, we are also receiving the list of eligible recipients. And also we have seen that out of the 3.5 million population, we have seen about 2 million of them have been completed to have the vaccination, and about 81% of them have also given us consent for the inoculation. And also at the elderly facilities, we have seen the facilities going through the investigation of 90,000 people, and about 93% of them have given us consent for the inoculation. And we are also considering the local government's conditions for setting up the vaccination centers, and we will be setting up these as schedules. And as for those who have given us their consent for vaccination, we are also providing them the details via text messages and phone calls, and we are also fixing the date for inoculation. And also for those who have been applied for the public secretary service, we will be providing the detailed information through SMS. And as for the safe transportation for them to the vaccination centers, we will also provide public vehicles as well, and the support will be also provided for people as well. Moreover, we are also cooperating with the local governments as well as the Ministry of the National Defense to have access to the vaccines for those who are living in remote areas. And also in islands, people who are living on the islands, we are also providing them more support to have access for these vaccinations. And because the only transportation means is via a ship, we are also providing them with some surveys. So if it is difficult for them to visit a center, we are also going to cooperate with the local governments to provide a vaccination in May. And we will also utilize the vaccine doses that are easy to be transported. And as for these places, remote areas, we will be closely cooperating with the local public health centers. And at the islands, we are also going to utilize vessels and marine ships as well going forward. And also starting from April 1st, we will have some vaccination centers that will open their doors to inoculate the people, and we will be continued to providing them with supplies and support. And we have also provided them an opportunity to provide a mock training as well. And until the end of April, we are mandating all of the local governments to open at least another additional center. Thank you very much.
예방접종 피해조사반장 김준.
Right, that was Chung Young with Monday's afternoon briefing. So what did she have to say?
First off, the average in domestic infections has risen by 1.7% from the week before at 422 infections. And on variant updates, there have been reported 40 new variant cases in the past week, which includes 22 domestic infections and 18 imported cases. And as we're approaching April now, Chung mentioned that in April, the vaccination program for those aged 75 and above will start. And also Pfizer vaccines are going to arrive on a weekly basis in April. But there's been one change regarding the AstraZeneca vaccine supplied through the COVAX facility. That arrival will slightly be delayed.
I see. All right, so thank you for that.
Thank you.
Companies have to honor their contract to the European Union before they export to other regions in the world. And this is, of course, the case with AstraZeneca.
I know it's ambitious, twice our original goal, but no other country in the world has even come close, not even close to what we're doing. I believe we can do it.
향후에 이제 백신 공급이 보다 확대되고 접종 대상자군도 일반 국민으로 더 확대되면서 11월 집단 면역 목표 달성에는 차질이 없을 것으로 생각하고 있습니다.
A nationalistic approach to COVID-19 vaccines looks to disrupt containment efforts across the world and prolong the pandemic amid the absence of a globally coordinated response. Now, for more on this reality, I have visiting Professor An Jun-sung from Yonsei University. Good to see you again, Professor.
Thank you.
And I also have Dr. Katharina Song at the National Vaccine Institute joining us virtually. Good to see you again, Dr. Song.
Thank you. Thank you for having me.
Right. Meanwhile, over in the UK, I have healthcare journalist David Cox on the line. Hello, David.
Thanks for having me on the show again, Sunny.
Right then, Professor An, let's begin with the standoff between the UK and the European Union with regard to COVID-19 vaccines. What can you tell us?
Yeah, I think there are two different aspects to the question, actually, for the political and legal perspectives. From political perspective, I think that EU can make arguments basically saying that, the pharmaceutical company, namely in this case is AstraZeneca, should honor their contract. However, from legal perspective, that's quite a different story. Actually, the AstraZeneca entered into a separate agreement with EU and UK last year. Their contract actually substantially similar. Actually, both contracts have the regional best reasonable effort clause. Basically means that they will do their best under the circumstances, and means that any similar company would do under the similar situation. So it's kind of what we call, like, legally speaking, escape clause. Basically means that they give quite discretion to the party who doing on the obligation. Right. So also there's other things. The EU, now we're talking about is that there's another contract between the license agreement, the patent between the University of Oxford and then the AstraZeneca. Basically, the AstraZeneca using the patent developed by the University of Oxford. So basically, they are head licensor under the contract, so they could limit the scope of territory, which would be the United Kingdom. So I guess that's quite reasonable from the EU. The UK perspective, they entered contract with as the head licensor, also the buyer, right? So two separate. So from the legal perspective, EU argument is not really, persuasive because that their arguments pretty weak. So I think the way it's happening was that it's about the Brexit, how they approach the Brexit situation, because the UK government, I think they're well prepared for the Brexit, but maybe EU government was not really prepared for it, because that it could be a success story from the UK perspective, why they have to get out of the EU, right? Or on the vice versa, maybe very sad story from the European side.
I see. And Dr. Sung, India has also placed a temporary halt on exports of AstraZeneca vaccines. Could you tell us more about this, Dr. Sung?
Yes. So in India, there has been a halt of the exports. So one of the situation behind it is that in India, they have one of the biggest manufacturer, India Serum Institute. It produces AstraZeneca vaccine, and it is a key supplier to COVAX. But the COVAX facility may be impacted with this recent India's decision. And in Europe, Europe also has several manufacturing facilities of AstraZeneca vaccine, and recently EMA approved new production sites in Germany, Netherlands, and Switzerland. But not only for AstraZeneca, but also for Pfizer and BioNTech and Moderna.
Dr. Sung, how do you explain the troubling rise of vaccine nationalism?
So globally, supply seems to be not insufficient. One study indicated that production from the vaccine makers would be enough to inoculate 70% of the world if distributed equally. Nevertheless, many developing countries have received only a fraction of doses promised through COVAX. It seems obvious that there is imbalance in vaccine distribution between the countries. The virus may evolve to produce mutation or cause a resurgence if it prolongs. The mutation and the resurgence may have been one of the causes to escalate the vaccine nationalism, but the result of the nationalism can extend the duration of pandemic for the world.
Right. Meanwhile, David, I hear there's been a dramatic decrease in the UK's death toll amid widespread public inoculations. Is this true?
Yes, the situation in the UK is actually it's pretty good at the moment, and it's definitely getting better. So at the moment, we've had, I think, more than 30 million people in the country have had a first dose of the vaccine, which has been extremely positive. And yes, at the moment, basically, the death rate has fallen quite dramatically. It's about the rate that it was last summer at the end of the first wave right now. And also the case numbers are also falling dramatically. So we're currently having about 4,000 a day compared to 10,000 a day at the end of January. So that has all been great, but I think the key thing for us is the next big day in terms of the restrictions being loosened is April the 12th, so that's when pubs and restaurants will open again. So I think that will be the real test of the vaccine rollout, whether it can stem the infections after that.
Right. And David, what are the potential repercussions of the EU's halt of AstraZeneca vaccines to the UK?
So this is the thing, so several elements of both the AstraZeneca and the Pfizer vaccines are made in EU countries like Belgium. And obviously those two vaccines are very key at the moment to the UK vaccine rollout. So obviously, as the EU have been threatening at the moment to ban vaccine exports over the past week, if that did happen, that would have major repercussions for the UK. I mean, I think particularly in terms of trying to get everyone their second vaccinations in time, that would make things very difficult. But I think we have seen this war of words and rhetoric from the EU over the past week, and I'm not sure that we will see a full vaccine export ban, because I think it would just damage the reputation of the EU too much across the world.
Right, I see. And over in the US, Professor, and the Biden administration has doubled its vaccination target to 200 million doses within its first 100 days in office. What are your thoughts on this ambitious plan?
Well, I guess President Biden signed the executive order to ban the vaccine export, just like the former President Trump, right? It's like for the foreign countries, it's like American first again, right? So it's very concerning, and things happen because the global leader, the company, the United States, doing something to show, they should show them example to other country, but they kind of monopolizing their vaccine supply. That's very concerning. So that's concern. Also, India was doing very similar things, and then UK, and so it's very concerning about the global perspective, and we need to get secure the the global chain of the vaccine ready. Right.
And staying with that, Professor, do you share concerns that vaccine nationalism could affect the vaccine procurement by developing countries?
Yeah, that's a very concerning issue here. I think that it's this global pandemic, right? If there's one country, they get a very high vaccination rate or inoculation rate, doesn't really guarantee that demise of the vaccine, right? Because it's really global, and then people moving around, and then you open up some small area, doesn't mean you really get, and then there's a mutation also coming up. So I think that we need to get international cooperation among the international countries, and then you need to get really global leadership on that.
Right. And Dr. Song, keeping in mind what Professor An has just said, do you believe, or what do you suppose are ways to deal with vaccine nationalism?
So COVID-19 is not just a disease that is of concern for one country, but is a global problem affecting every country at the moment. There is a need for the world to collaborate to get through the situation. Even before the pandemic, there were differences in vaccination rate by countries, influenced by many factors. International organizations such as WHO or Gov'T Alliance put efforts in equal vaccine distribution around the world. After COVID, COVAX was formed, co-led by CEPI, Gavi, and WHO, alongside key delivery partner UNICEF. COVAX is the vaccine pillar of the Access to COVID-19 Tools Accelerator Act. During the initial stage, COVAX put a lot of effort for many countries to be contracted with COVAX to offer doses at least 20% of countries' population and deliver vaccines as soon as they are available.
David, some observers claim that efforts to offer the first dose of the COVID-19 vaccine in the UK to a greater number of people are affecting inoculation schedules for the second dose. What are your thoughts on this?
So currently the data does suggest that the UK is meeting its targets of giving everyone their second dose of the vaccine within 12 weeks of the first. So I think at the moment more than 3.5 million adults in the UK have received their second dose, which needed to happen by April the 9th. So currently well on target. But I think with the current situation with the EU and those tensions, it is still very much a concern. I mean, if the EU do follow ahead with their threats and we do get a ban on vaccine exports, suddenly the situation may not look as good as it is at the moment. So I think that one option is potentially mixing vaccines. So the UK is getting 17 million doses of the Moderna vaccine by the end of April. So one option could be to say give someone who's had one dose of the Pfizer vaccine a Moderna vaccine as their second dose. So I think that's one option we might see. But I think it still could be less of a problem.
Right. And speaking about being problems, Dr. Song, Korea hopes to secure herd immunity by this November. Now, how feasible is this plan amid the presence of vaccine nationalism?
So Korea planned to introduce 7 million doses of AstraZeneca vaccine directly through AstraZeneca in May and June. and 6.5 million doses of Pfizer vaccine from March to June, and 2.1 million doses of AstraZeneca vaccine through COVAX facility. But we just have heard from Dr. Zhang from KDCA. The introduction plan for COVAX facility may be impacted by this events. So AstraZeneca vaccine in Korea are produced by SK Bioscience through contracted manufacturing. And with Novavax, tech transfer contract has been made, yet bulk material for Novavax vaccine production may not be sufficient. Therefore, Korea vaccine supply could be potentially impacted as well. For vaccines, even in normal situation without COVID-19, supply issue may always happen. Backup plans such as accelerated introduction of the vaccines may help in long run.
Right. And Professor An, keeping in mind what Dr. Song has just said, what are your words of advice with regard to Korea's vaccine procurement efforts?
Yeah, I guess it's upsetting a priority. And I think the Korean government should decide what kind of priority. Are we going for the global leadership and willing to share out the vaccine with other countries? Or I think that's a big question to ask. And then also we need to get in the long term, just like a European country like Germany, and you have to diversify that vaccine manufacturing facility locally and globally. I think that's the long-term plan. Right?
Right, I see. All right then, Professor An, as always, thank you very much for your thoughts. Dr. Song, thank you for being with us today. And David over in the UK, thank you for your time this morning.
Thank you.
Right then, Korea is under a yellow dust warning and authorities are urging for the wearing of face masks to ensure protection against air pollution and the pandemic. Thank you for watching.